Good afternoon and welcome. Thank you all for joining me for Getting Started with Information Outreach in Your Community. My name is Kiri Burkhat. I'm the Data and Evaluation Coordinator for the Network of the National Library of Medicine Southeastern Atlantic region. My colleague Molly is in here too, just to sort of help with the chat box and help answer questions, so you may see her jumping in to answer questions. Speaking of the chat box, as you're typing questions or comments, please make sure that you're sending them to all participants. Oh, she's one step ahead of me. Sending to all participants so that your colleagues can all see them. I'm going to attempt to pause periodically during the presentation to take a look at what is going on in the chat box and answer whatever questions I can at that point. I'm going to be sharing a lot of different online resources with you today. And there is a handout with links to all of those resources at the course homepage. So it gets a little bit clunky to switch back and forth between screen sharing and presentation mode, so I'm not going to do that. I'm going to stay in this PowerPoint for the whole presentation, but I do encourage you to follow along and take a look at all of these resources as we go through them. And you can find them all from that document. I expect a lot of you are hoping to claim MLA-CEs or CHIS credits from attending the presentation. I am going to share a link to the survey that you'll fill out to claim the MLA-CE code, and that's what you'll use to redeem that credit. So if you stick around, you'll get the link to the CE code in the survey at the end of the presentation. And I think that since we've all been working from home at NNLM, we've been getting a lot of new people in our webinars. So before I get further into our class today, I just want to share quickly who we are. I'm sure many of you are familiar with these acronyms, but many people are still a little bit confused as to how they all fit together, and understandably so. So at the very top there, the NIH, the National Institutes of Health, is the nation's leading medical research agency. So the NIH is comprised of 27 institutes and offices, of which the National Library of Medicine is one of them. And the NLM is the world's largest biomedical library, maintains a vast print collection, but is now probably better known for producing electronic information resources like Medline Plus, the government's main consumer health information site, and PubMed. And then below NLM is NNLM, the network of the National Library of Medicine. And we are a program that is comprised of 8 different regional medical libraries, and we sort of perform outreach and education programs for the NLM. I work, as I mentioned, for the Southeastern Atlantic region, and we serve states from Maryland down to Florida, over to Mississippi, in addition to the U.S. Virgin Islands, Puerto Rico, and D.C. And our office is located at University of Maryland, Baltimore. So lots of different pieces fitting together to make this picture. So let's jump into today's agenda. This is kind of going to be a whirlwind tour of resources for you as you plan information outreach projects in your community. I'm going to touch really briefly on lots of different topics and essentially provide links to further information so that you can dive more deeply into these topics on your own. So the first one is defining cultural competency. We'll talk about what it means and particularly why it is so important for effective health information outreach. Next, we'll examine ways to learn about local communities. And in this section, we're going to discuss a variety of online resources that you can use to help you leverage the local data that's available to you. And of course, that's not the only way, or even in many cases, the best way to assess your community's needs. But there really is so much information available to you, so we are going to spend some time today focusing on community health and demographic data. And then third, we'll talk about the ways that you can apply principles of cultural competency through your outreach projects. So you may already be underway with a project. You may be sort of brainstorming right now, or you've recently implemented one and you'd like to build on it. And we'll talk about how you can learn from other projects and then some tools that we provide for assessing your outcomes and results. So to start, I want to get a baseline of how we define culture. It's a broad term, it encompasses a lot. So I want to start by asking, what does culture mean to you? What comes to mind whenever you hear that term? Take a moment to think about it, and then please share in the chat box. I see shared values, shared beliefs, traditions that define a population, family structures, rituals, a collection of shared history and tradition. Okay, personal experiences as they relate to the life experience. That's great. How one defines his or her identity. Right, so a lot of folks are talking about sort of shared values, shared beliefs, and the ways that we define ourselves and understand our experiences kind of in a larger context. So the definition that I found is the thoughts, communications, actions, customs, beliefs, values, and institutions of racial, ethnic, religious, or social groups. So we are all, of course, sort of steeped in our own culture. We're not always aware of it, but we're interacting with others who are sort of, again, surrounded by their own culture. So we have to find ways to communicate with each other across these different shared beliefs. And this is really important because culture, of course, affects all aspects of our interactions with others. So thinking more specifically about how culture and health intersect is really important. Culture affects how healthcare information is received. So not only from whom we receive health information, like a healthcare professional or a family member, but also the means through which that information is conveyed, right? So it could be one-on-one at a doctor's office or as part of a group at a health fair or a public health office. Culture affects how rights and protections are exercised. So who has access to information? What information is shared and by whom? What is even considered a health problem can vary based on your beliefs. So what's the difference between something that would be considered just a scratch, something that necessitates a doctor's office appointment, or even something that necessitates an emergency room visit? It can affect how symptoms and concerns about a problem are expressed, and how different interpretations can vary between different populations. Are symptoms approached more privately? Are they more likely to be shared freely and without reservation? It might influence how you feel about who should provide treatment for the problem and what type of treatment should be given, right? So how would you like to approach the problem? Through surgery, through medications, or through lifestyle changes? And knowing the answers to all of these questions ahead of time will help you tailor your programming and your outreach to the populations that you're trying to reach. And this is kind of the underpinning of the concept of cultural competence. There are a lot of different definitions of cultural competence, but here's one that kind of encompasses the considerations of the previous slide. Cultural competence is being aware of integrated patterns of human behavior that include the language, thoughts, communications, actions, customs, beliefs, values, and institutions of racial, ethnic, religious, or social groups. And as our health system moves toward patient-centered care to improve the quality of care and to reduce costs, patients and providers increasingly need to be able to work together. So to demonstrate cultural competence as you plan, consider beliefs about objects, symbols, the body, non-traditional medicine, different communication styles, the different roles of relationships in different belief systems, ways of learning new information and how they may differ across cultures, the role of translators and interpreters, perceptions of authority figures, and even different conventions of nonverbal communication. So continuing kind of on this topic, I want to take a brief moment to talk about the term cultural humility and sort of the interface between cultural competence and cultural humility, because these are two models of similar things. And the idea of cultural humility wasn't really explicitly emphasized in previous offerings of this presentation, but we got some helpful feedback from a participant last time we did this back in April, encouraging us to talk a little bit more deeply about this. So a brief summary, my understanding is that cultural competence is a term that came out of the social work literature in the early 1980s, and the premise of this concept is that knowledge of a culture is essential to effective or competent practice across cultures. Then in the late 90s, some nursing scholars proposed that this cultural competence discussion and framework be redefined by cultural humility. And some criticisms of cultural competence surround the idea that it is something that can be achieved, essentially. Many people are wary of the implication that you can follow a set of principles and then be deemed, quote, culturally competent. Cultural humility, on the other hand, refers more to the importance of lifelong self-reflection. So you can say that these ideas are complementary. You can say that they're parallel. You can say that they're competing. People say all of these things. You could think of it kind of as cultural competence referring to a product and cultural humility referring to a process. In the context of today, we're mostly just sort of talking about some things to think about when you're planning and marketing programs. But NNLM has hosted several other webinars that focus more on cultural humility, and I'll send you the links to those in the email after this presentation, so you can explore them more if you'd like to. So a quick example of cultural awareness and the importance of cultural competence in a health environment. In 2013, Seattle Children's Hospital redesigned their wayfinding system to rely on visual information via color patterns, signage, and art. And in preparation, the facilities team requested a literature search regarding cultural implications of animal representations as they see patients from all over the world. The new design incorporated Pacific Northwest ecosystems for hospital zones, and each elevator bank was named for an animal in that zone. So like the whale elevators in the ocean zone and the bear elevators in the mountain zone. And even with this research, well, I guess in the course of this research, even with good intentions, some issues arose. The elevators in the forest zone were originally the owl elevators, and they learned quickly that the owl is a symbol of death in some cultures, and Native families reported feeling uncomfortable with that image. So they changed it in the design process to the rabbit elevators. In addition, to ensure that the new system would be easily understood by all of the populations the hospital served, they tested the icons, signs, and art with patients, families, and staff. And testing helped uncover which designs would be the most universally understandable and culturally acceptable. And of course, they also selected colors for their wayfinding art that would be distinguishable by those with different types of color blindness. So there are sort of many different driving forces behind the need for cultural competency. There are some legal guidelines that encourage and I suppose enforce the idea. One is Title VI of the Civil Rights Act of 1964, which says that no person in the United States shall, on the ground of race, color, or national origin, be excluded from participation in, be denied benefits of, or be subjected to discrimination under any program or activity receiving federal financial assistance. Next, a little bit more specific to health information and health services specifically. The Health and Human Services Culturally and Linguistically Appropriate Services Standards, or the CLAS standards. And this is a collective set of mandates, guidelines, and recommendations issued by the United States Department of Health and Human Services, Office of Minority Health, intended to sort of guide and facilitate required and recommended practices related to culturally appropriate health services. And third on the slide, new Joint Commission recommendations for hospitals, policymakers, and researchers about effective communication and patient and family-centered care. So those are kind of the regulatory teeth behind cultural competency, but of course the idea behind all of these official recommendations is that cultural competence supports the health outcomes that we're looking to achieve anyway, right? And that's the provision of health services that are respectful of and responsive to the health beliefs, practices, and needs of diverse patients, with the hope that this will improve health outcomes across the board. So patients need health information written or conveyed in a language that they can understand, and they need to know how to navigate the healthcare system, electronic record system, understand recommendations from their doctors, and communicate effectively with their healthcare providers. And for all of us from an information professionals perspective, we hope that this is one angle from which we can approach health disparities. So, as defined by the CDC's Healthy People 2020, health equity is the attainment of the highest level of health for all people. Achieving health equity requires valuing everyone equally, with focused and ongoing efforts to address avoidable inequities, historical and contemporary injustices, and the elimination of health and healthcare disparities. So with this definition in mind, it's time to do a needs assessment or an environmental scan and try to identify some of those service needs. So, of course, thanks to the internet, it's relatively easy to find data about communities which can help you determine the right mix of services and information that's going to be the most relevant to the populations in your own community. So from the next few resources, we're mostly going to be looking for information on predominant languages spoken, ethnicity, race, age group percentages, and socioeconomic status to see kind of a demographic snapshot of the community. And we'll start very generally. The United States Census Bureau is a division of the U.S. Department of Commerce, and it provides numbers and stats and counts on the population and the economy. Each state has one Census Bureau data center whose role it is to provide access to the U.S. Census Bureau data. And the State Data Center program makes data available locally to the public through a network of state agencies and universities and regional and local governments. So the next few resources are all going to fall under the census.gov umbrella. Data.census.gov is the main online destination for exploring this data, and it provides access to information across the United States, Puerto Rico, and the island areas. So even though the last census was in 2010, you can find some key stats such as population, income, education, and age from the more frequent supplemental censuses and surveys, such as the American Community Survey, which I think is at this point as recent as 2018. And all of these results can be filtered down to the zip code level. So census.gov's state and county quick facts include statistics for states and counties, of course, and for cities and towns with more than 5,000 people. So from here, you can compare your county or city with national averages and with other counties and cities. So there's a drop-down box on this page that'll give you a whole bunch of different options. And for example, if you choose education, you can see the proportion of Baltimore City residents with high school diplomas and bachelor's degrees compared to the national proportion. And Baltimore has a slightly lower proportion of high school graduates than the country as a whole, but it looks like bachelor's degrees are pretty close. So there are other topics including housing, which may give you insights to the percentage of apartment dwellers versus single-family homes, or the transportation topic, which could highlight the access or lack of access that communities may have to different resources. You can access a lot of this information through the Census Data Mapper. And this is a web mapping application that is intended to give you kind of a simple interface to view, save, print, present county-based demographic maps of the United States. So I think this resource specifically is still based on the 2010 census, so it is soon due for an update with this year's data. But you can look at themes like age and sex, population and race, and family and housing. And the map is customizable down to color choices, and you can adjust the number of distinct classes for data representation and for classification type. So a closer look at that. Here's a map of the Midwest. Looking at the looking at the menu down the side, we have a theme of population and race, and the data table that this is pulling from is % American Indian and Alaska Native. And from this view, we don't actually see much of anything. So the key here is to figure out which classification type is going to work best. So on this view, I chose equal interval, but if we change it to quantile instead, this is the same data theme and table, still in 5 classes, but the quartile, the top quantile divides the top 1.1 to 96%. So whether or not that's what you're looking for, pay attention to classification type when you're using this resource to make sure that you're actually getting useful results. Another source for demographic information is the Modern Language Association language map. And of course, language is not the only component of cultural competency, but it can still be a significant barrier to health information. The language map uses aggregated data from the Census Bureau, from the American Community Surveys, and from the Modern Language Association's Language Enrollment Census to display the locations and numbers of speakers of 12 languages commonly spoken in the United States. So the image on the screen right now is of prevalent languages taught, excluding English and Spanish. And this one maps Maryland. And the magenta color on a few of the counties as for Korean as a predominant language spoken. I'm located in Howard County, Maryland, which is the magenta county with the dot that says Columbia, kind of near Baltimore. And that recognition of Korean as a prevalent language definitely reflects my experience working in the county public library system. The language map is also available through MLA's Language Map Data Center, and this offers some more detailed numbers beyond percentages. So there are some interactive pie charts for predominant languages spoken beside English, and here you can also find spoken English proficiency totals on a scale of very well to not at all. So here you can see most spoken languages in Maryland in 2010, a little bit outdated. It looks like they're pulling from the 2010 census. But it's kind of more detail than the county map provides. So moving to some more health-specific information and data, another really great resource from the U.S. government is Partners in Information Access for the Public Health Workforce, phpartners.org. And this organization's mission is helping the public health workforce find and use information effectively to improve and protect the public's health. And partners involved in creating this resource include the Medical Library Association, the Network of the National Library of Medicine, and the National Library of Medicine. So this is a great repository for all sorts of health topics, education, promotion, and campaigns. And you can look there for program ideas or potential partner inspiration as you're planning your own projects. Health data, tools, statistics, and maps, which we've already covered a little bit. And also a lot of information about grants, funding, legislation, and policy. And you can kind of see all of that on the screenshot with the icons. One feature that I particularly want to note are the structured evidence queries. So the site has some pre-made PubMed search strings that are created for specific research queries that correlate to specific objectives from Healthy People 2020, and which is from the CDC. So this is helpful for quickly finding relevant research that is directly correlated with outcomes. There's a really long list of categories. In the screenshot, I just opened the top one, and I have a box there over the search button for access to healthcare, or access to, health services. So if you're interested in doing some kind of project about health insurance literacy or preventative care, you could just click that second objective there. And it takes you straight to the PubMed search results for that query. So you can see the search string in the box at the top that it used. And our #1 result here is about promoting prevention under the Affordable Care Act. So this is a feature to remember and can be helpful if you're looking for evidence to support a project proposal. So the County Health Rankings and Roadmaps is another really comprehensive resource. It's a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Public Health Institute. And together they measure and weigh various social and economic determinants throughout the United States to look at how all of these factors coalesce to positively or adversely affect health outcomes. You can sort of see on the diagram there, they're looking at health behaviors, clinical care, social and economic factors, and the physical environment. And they calculate scores for all these different factors within a county and then rank the counties within each state. So here's Maryland again. This is a screenshot from the site of the overall county rankings in health outcomes and then in health factors. There are 24 counties in the state. The top ranking ones are the lightest color, and the bottom ranking ones are the darkest color. You can click on each county. So if I click again on Howard County, which is the HO near Baltimore on this map, I can look at all of the different individual measures that factor into that ranking and compare them to top US performers and to the Maryland average. And each of those measures that are listed down the left, you can click on them and see the state map based on that specific measure. Back in March, the county health rankings and roadmaps released the 9th annual county health rankings. And with this release, they published the 2019 data, as well as some tips for using featured tools and resources, advice for how to leverage the rankings to spur action in your community, and a webinar called Making the Most of the 2019 County Health Rankings Release. And this is all very helpful because they use so much math to come up with these scores that it can be a little bit hard to dissect them and find the actionable data. And I'm actually going to drop the link to that webinar in the chat box right now because I don't think it is on the handout that I shared at the beginning. And I'll include that in the email as well. Of course, aside from all of these sweeping national programs, your own state health departments have their own resources and data. The CDC Center for Chronic Disease Prevention and Health Promotion compiles all of this information from state public health offices on their state snapshots site. So you can select your state, and then you can view the top health priorities in your state, which you could then, of course, use to tie to your library or outreach programming. And you can get links to the state health department's homepage and other sources of health statistics. All right, so here's what the state snapshots site looks like. And once you've gone to the snapshots and selected your state, you can see the different types of state-specific information available. There is a section that's highlighted on this slide called Helpful Links, which I think is really great. And the top one is usually the link to the state's Department of Health homepage. So here's an example from the Wisconsin Department of Health Services. You can also find reports that contain state health statistics, like this report from the Louisiana Department of Health. And some bigger cities and metropolitan areas might have their own reports, like Healthy Chicago 2.0, a community health assessment from the City of Chicago Department of Health. So these are all potential tools that you can use to learn more about your communities sort of at a demographic level and learn about some of the health issues that are particularly prevalent where you live. But of course, keep in mind that you are kind of the best community resource that you have. So we give you maps and diagrams and data to help you along, but thinking about what you already know about your community and your experiences and populations that you're working with day to day at your libraries, think about some of these kind of informal ways that you're learning every day. So a quick checklist to consider when planning community outreach. We talked a lot about identifying and learning about your audience. We provided some information sources that you can look at, but of course, you want to think about sort of the information sources that your community is using. So how do the people that you work with get their health information, and think about how you can complement that with your own programming. You can also think about where your community sort of congregates and where different populations within the community are already gathering. So could you partner with schools or public health agencies, faith-based organizations, or senior centers? The NNLM has funded an outreach project in a laundromat in the past, and in the southeastern Atlantic region where I work, we have supported a long-running partnership between a public library and a hair salon that's been really successful in that community. And then the fourth bullet point there is engagement. And this is so important, and in the scope of this presentation, it's kind of boiled down to one bullet point on one slide. But of course, in order to meaningfully engage with your community, it is important to build trust and build relationships. And the only way to do that is by talking to people. Support from community leaders is going to be critical to the success of your outreach, and talking to people about what they need and what they want is going to be absolutely crucial for designing programs that serve them. And I'm going to drop another link in the chat box right here to kind of a recent webinar that delves more deeply into kind of the difference between outreach and engagement. And this is from our colleagues at the University of Florida, where they discussed and shared some of their lessons learned from community engagement efforts. I think that is on the handout, but I'll drop it here again. With all of that in mind, here are some other NNLM opportunities for reaching out to your communities. We do a lot of work in this area and have a lot of offerings, but these are selected specifically for their emphasis on providing culturally relevant information. So the first one there, From Beyond Our Borders, is about providing multilingual and multicultural health information in the preferred language of the population. And again, language is not the only barrier to healthcare, but it can be a large one. And then those other two, Serving Diverse Communities and Diversity, Equity, and Inclusion, both focus on accessing health information resources related to diverse communities. They discuss health disparities more deeply, and also talk more about building culturally humble workplaces. And the NNLM funds hundreds of outreach projects and programs every year, as well as professional development funding that are sort of offered periodically throughout the year. So while timelines and amounts can vary from region to region, if you've got a project in mind, you can visit that nnlm.gov/funding to learn more. If you'd like to draw inspiration from past projects, or if you're looking to connect with organizations that have projects underway, again, the NNLM has a wealth of information on projects that we've supported in the past. If you're just sort of at the very beginning of the brainstorming process, you can take a look there and see what other groups have done, and maybe find some people you can contact to talk to about that project. And you can filter by different populations, like seniors, teens, rural populations, inner city populations, or you can filter by your organization type, public library, academic library, or hospital. Healthypeople.gov has a section called Healthy People in Action. It has a lot of stories focusing on partnerships and collaborations across communities and sectors, and also some information and lessons learned about measuring the impact of prevention activities. And then again, also under the broad Health and Human Services umbrella, the Rural Health Information. So the Rural Health Information Hub has over 60 health topic guides on agricultural health, telehealth, and rural disparities specifically, and population groups population groups that are specific to rural areas with statistics and data for each of those. Once you've identified a topic and an audience that you'd like to focus on, the National Network of Libraries of Medicine has resources to help you with outreach planning and outreach evaluation. So here on the slide are some of our Getting Started with Community-Based Outreach Evaluation Guides, and these present step-by-step research, planning, and evaluation methods that walk you through a project from start to finish. So each one of these booklets focuses on a different part of the project lifecycle, and it includes a case study and worksheets to assist with outreach planning. So these are free and downloadable, also available in HTML versions, and you can always contact your regional medical library and your regional coordinators for more support and more assistance. Now, I expect many of you are here because you have exciting projects that you're thinking of starting on, and I would love to hear about some of them. I'm sure that some of your colleagues would love to hear about some of them. So I'm going to ask you, are you planning on participating in an outreach project? And we'd love to hear about it in the chat box. Yeah, it's true. Ashley commented that they're only doing virtual projects right now. So I suppose this is a strange time to be planning outreach in your community. Things are so unpredictable and different than they've ever been before. Okay, again, a comment from Caitlin. She's referring to the All of Us research program, which is an NIH program that's focused on precision medicine and reaching communities that are traditionally underrepresented in medical research. Graphic Novel Book Club and Graphic Medicine, NNLM has done a lot with that. Facebook Live and WhatsApp, which is great, especially right now while we're all looking for online alternatives to sort of our traditional methods. Rizan is working with a nonprofit organization with HIV patients. And I see someone is saying that my voice is breaking up. Sorry, I'll try to speak more slowly and see if that helps. All right, and Molly commented on some virtual programming ideas from the GMR, which is the Greater Midwest region of the NNLM. They had a really well-attended webinar about planning virtual programming and outreach. Great. So a lot of you are making plans despite the unpredictable situation and all of the challenges, the unprecedented challenges that we're dealing with right now. And I hope as you continue to brainstorm ideas or deliver new services, you keep the NNLM in mind as you're thinking of your projects. So a few parting thoughts just to sum up today's presentation. Of course, as you're planning, learn about your audience, think critically about the barriers that they may face to meaningful health information, and engage with members of your community to learn what is most important to the people that you're hoping to reach. Second, think about how you're going to conduct a needs assessment, both data-driven from some of the online resources and research that we discussed today, but also who can you talk to? And then brainstorm. What are your ideas? What are the outcomes that you hope to achieve? And how can you assess your project and learn from it? Like I said, I hope you keep us here at the NNLM in mind. We have a lot of information resources for planning and a lot of funding opportunities to actually support health information outreach in your communities. So with that, I'd like to thank you all for attending. That's me, I'm Kiri Burkhat. If you registered before today, you got an email from me already this morning, but there's my contact information and you'll hear from me again in about a week. Let me drop the link to that survey in the chat box so you can click on it. And I see Molly just did, but I'm already on my way. So that's the survey that you can use to evaluate today's presentation and also claim the MLA credit for it. For those of you who joined partway through, I was recording today, so if you'd like to catch the beginning, you should be able to access this presentation on YouTube in about a week, and you'll still be able to use that evaluation and CE code. So thank you very much. If there are any questions, I've got a little bit of time to try to answer them now. And I didn't see any questions coming in. I don't see any questions coming in now. So I'll be here for a few more minutes, but you also have my contact information, and please feel free to reach out anytime with anything that pops up later. And Jennifer, yes, let me find that link for you. Oh, okay. That appeared oddly, but that second thing there, the nnlm.gov/neo, that's the link to the evaluation guides. Hi, Monica. I don't know if I can specifically answer your question right now off the top of my head, but I will definitely sort of sift through some of these resources again to see if I find something that kind of fits your question about the evidence-based programs to implement in the community. All right, I'm going to go ahead and mute myself. Thank you all again for attending. Don't hesitate to reach out, and have a great afternoon.